benign positional vertigo is like the word says, is benign, is nothing serious. Positional because it has to do with the position of your head or your body in relationship with gravity. And vertigo is the medical word for the spinning sensation that the person feels as a result.
Otoconia, they're crystals. That is what people hear them called as. It's more like sludge or sand. It's kind of limestone that's in our inner ear that we're supposed to have. It has a job. It gets dislodged and gets into the canals that we have.
The function of that is to provide weight to those little cells that are underneath so that it knows when you're moving in and out of gravity.
A lot of people will feel some nausea. There's varying degrees of how you feel. But just think of every time you forget and you go to look up and it grabs something out of a shelf, you tilt your head back and you're dizzy.
It is more common in women than men, and more typically more common in women over 50 years old.
It can be momentary, up to a minute or two of actual spinning. The room spins or you spin, but there's actually a spinning motion.
And it's a very easy condition to fix. It's very common as well. 1 in 3 people have it.
So our job with that is to find out which canal it's in. And then we treat it by a series of different motions that what we're trying to do is actually dump the crystals out of the canal. Usually it takes 4 sessions or so. Sometimes after we do it, the actual vertigo, the spinning symptoms resolve.
So basically when we do the Epley maneuver, we move the person in a certain way to dump the crystals back there to the center chamber where they belong. And once we put them there, the patient feels much better. So as a result, what we do is do a lot of balance exercises, adaptation, and habituation exercises so that the brain receives equal signals, and in that way the person can regain their balance and their sense of well-being.